Are we live?
We are.
All right. Well, good evening, and thank you for joining us for the 8th week of our Health at Home series. I'm Andrew Asato, the Executive Director of Susan G. Komen, Oregon and Southwest Washington. And tonight I'm so thankful to be joined by Dr. Thomas Gibson of St. Vincent, Providence Health Systems. Tonight's topic is reopening breast cancer centers for screening and diagnostic exams amidst the shelter in place. So Dr. Gibson, thank you so much for joining us, and would love to have you just share a little bit about yourself, your background, and your role at Providence.
Sure. Yeah. Thank you for having me. So Dr. Thomas Gibson. I did all my training up at Oregon Health and Science University, and then now I work for TRG Imaging, and we cover Providence St. Vincent's Hospital, Newburgh Medical Center, Seaside Hospital, and then 2 outpatient imaging centers, Tannisbourne and Bridgeport. And so I'm involved with the overall multidisciplinary approach to breast health, and I'm one of the specialty breast imagers at Providence.
So we've been sheltering in place now for 2 months. My first question to you is, how has care evolved in your breast cancer centers?
Right. So I think first off, it doesn't feel like 2 months. It feels like it's been 14 years.
Yes, it does.
Sprinkle in.
We just talked about that today in our office.
Yeah. The homeschooling, I feel like it's dog years. Yeah. But
as a parent, yeah.
Yeah, as a parent, but that's off script. For our breast cancer center, how's it evolved? So when this initially happened, kind of all screening just stopped. Like in a matter of, it seemed like 48, 72 hours, just everything halted, and we just ended up rescheduling everybody. And at that time, we were able to kind of look at our own department and kind of see what's worked and what has not worked. Like, where are our efficiencies and where have we been inefficient in terms of time management, patient management. And so we were really able to look at everything and just leave no stone unturned, because eventually we were going to reopen. We knew that we were going to reopen at some point. And we get so much information every single day about COVID, and things were just going so fast that it was really early on that you knew COVID was going to be around for a while. And so we were able to just look at our own institution, but then we were also able to talk to a lot of directors in this region, through the Providence network, and just a lot of directors, and just kind of really listen to what their opinions. Like, we spoke to people in Alaska and up in Washington, down in California. And I thought that was really powerful, because everybody's been affected by COVID just differently. It's hit Oregon different than it hit Alaska and California. And so you got a lot of input as to what people felt would be a good phased approach to open up systems as we were able to. And so we looked locally and then regionally, and then last was nationally. We got direction by the American College of Radiology and also by Society of Breast Imaging, and they were able to put out position statements in regard to social distancing and ways that it can be implemented when you open up. And so we were really able just to kind of rework everything, and during this time that we had, where we had to reschedule patients. So that was kind of what we did with our time and evolved our program.
So are you back open for screenings at Providence?
We are, yes. We are 100% open for screening, actually for all diagnostic imaging. And we started, I think it was about 3 weeks ago. And we had our kind of this robust planned rollout to start accepting patients again. And we didn't want to start at 100%, obviously. So we started at 60% of scheduling, because we wanted to prove that our plan was going to work. And we found out really quickly that it did work. And so we increased from 60% to 70%, and then now we're up at scheduling 100%.
That's great, because I know Komen National are messaging early on, because like you say, we didn't know.
Yeah.
We were all trying to figure this out. We're very cautious, saying if it was non-essential, we didn't want to expose people to a virus, by accident or expose people unintentionally. So we were very cautious. So it's great to hear that. And my next question was going to be, what does that mean for Providence? But it sounds like you have figured that out, because you've escalated with screening and also testing to make sure that what you're doing is appropriate.
Yeah, exactly.
So you're not scheduling at full capacity yet, or are you?
We are.
You are. Okay.
Yeah. We started at 60%, then we went up to 70% and 80, and now
And
we're scheduling at 100%.
that's fantastic. That's great for our listeners to know. For those tuning in, I'm talking to Dr. Thomas Gibson with St. Providence Health Systems at St. Vincent, and a radiologist. And if you have questions, I have a few that I'm asking Dr. Gibson, but if you have questions, please do queue them up, and then Dr. Gibson will be ready to answer those when we're finished. Uh, are you prioritizing one group over another with screening, or how does that work?
Yeah, so all the patients that we had to reschedule, the ones from March and April, the question was, how do we fit all these patients back into our schedule? We don't want to bump the people that have already have appointments for May and June, and so we took all the patients that we had that were kind of backlogged, I guess, to give it a word, and we were able to use kind of Epic to our advantage, and we were able to look at we were able to put them in the risk category, so high risk, intermediate risk, and low risk. And then based off of that, we're able to kind of prioritize and to call kind of all the high risk patients first and get them in for their screening, and intermediate and low risk. So that's kind of what we have done.
Okay. So what right now does a screening mammogram appointment look like at Providence? Are you booking out? Or is there a rush of people that are coming in now because they want to do their yearly appointments, or they have symptomatic?
Right. Yeah. So I guess I'll just explain kind of what the experience is now and kind of what it used to be, and this will kind of maybe explain what we've done and how things have evolved. Kind of the first question that you asked. So when you make your appointment, you can either make your appointment online or you can make a telephone call, and then you make your appointment. And then 24 hours before your appointment, you're going to get a telephone call, and you kind of register over the phone. And so you kind of you don't have to, when you get to the hospital, you don't register and take time just standing there. So that'll be already taken care of. You'll register on the phone. And then we'll ask you to wear a mask if you have a mask, because everybody's wearing masks in the hospital, providers, technicians, and patients, and even visitors. And then we also ask that you don't bring a visitor with you, because sometimes people want somebody there for support. And obviously, if you were like, I really want somebody there for support, by all means, bring them. But we try to encourage for you to come alone. And if you don't have a mask, obviously you get provided a mask. So when you hit the front doors of the hospital, you get your temperature checked, and if you don't have a mask, you'll get a mask, and you'll get asked the questions of, have you had a fever? Have you had a cough? Kind of the COVID screening questions. So you kind of have these two areas where you've been questioned already before you even make it to the Women's Imaging Center. And once you make it there, you pretty much come up and you check in, say that you're there, and you get taken straight back. Whereas before, you used to wait in the waiting area. And even in the waiting area, we've decreased the amount of chairs there. I think there's like a third of the amount of chairs that there used to be, so as to provide social distancing. And I didn't know this until we went through everything, but once we take the patient back, like, we have a lot of dressing rooms. And so pretty much each patient ends up having their own waiting room. They come back, and then they'll change in the dressing room, and then they wait in that dressing room for the technician to come and get them, and then take them to their appointment. And then from their appointment, they leave. And so a lot of the kind of checkpoints through the process, your exposure to other people is greatly minimized to how it used to be. Because used to be like waiting in a women's lounge while you were waiting to be taken back for your mammogram, and we're trying not to do that anymore.
Do you see any kind of concern or fear with patients or people coming through to get screening?
People are coming through to get tests. Oh, go ahead. I'm sorry.
Do people coming through, do they feel any kind of reservation coming in to get screened in terms of person contact, or do you feel like people feel, given in Providence system, they feel pretty safe and that's good?
No, I think that people feel pretty safe.
Good.
I think that we have had some people that have had concerns and for people about coming in and just being exposed to other people. And there's a couple of things they can do. Like, some people don't want to come to a hospital. They'll be nervous about coming to a hospital, which I don't think they need to be, but I understand why they would be. And we have the outpatient imaging centers that they can go and get their screening mammogram there. Or we're doing screening mammograms on the weekends now, which we weren't doing that previously. So on Saturdays, the hospital's slower on Saturdays. And so you can come in and get your screening mammogram then, if you don't want to come during the week. So there are other options if you're a little more, I guess, anxious about coming in. But I haven't noticed, I would say, about patients, and people are scheduling and appointments are filling and people are coming in and getting their mammograms.
Good. So this question I have to read because it's kind of lengthy. It actually came out of our recent Facebook Live Komen discussion separately. The chair of Komen's Scientific Advisory Council said his system has seen fewer breast cancer diagnoses during the pandemic. So the question is, are you seeing something similar at Providence? Has the number of breast cancer diagnoses changed in the last couple of months? And if it has, do you have any thoughts on why?
Yeah, our breast cancer diagnoses have decreased. If you were to compare to last year of March and April compared to this year of March and April, it is definitely lower. And I think it all ties into screening, honestly. We were doing diagnostic mammograms during the month of March and April, and specifically for patients that were having like palpable lumps, they would come in and we would do their diagnostic mammogram and their ultrasound and the workup and then a biopsy if needed. And so we were diagnosing breast cancers during that time frame, but they are less than they were like a year ago. And I think it is all due to screening because obviously a lot of breast cancers, they don't manifest with, physical exam findings. We catch it on imaging, and that's why we do screening. And unfortunately, breast cancer doesn't wait for pandemics to pass, No,
they don't. Yeah, they don't discriminate.
Yeah.
And yeah, so I have two more questions, and then I certainly welcome questions from our viewers. So please do post those at this time. So the next question: what does the diagnostic process look like today versus 2 months ago? And I think you kind of explained that, but if you want to elaborate on that.
Sure. The diagnostic process is pretty similar to when you get your screening mammogram now. We take all the same measures, obviously. And then getting your diagnostic mammogram, when you come in, you'll get your mammogram and you get your ultrasound, and you'll either a radiologist will come and talk to you, or the technician will let you know what the results are, and either you go back to routine screening, or we'll see you in a couple, 6 months or a year for additional imaging, or we'll recommend a biopsy on something. But the diagnostic process is very similar to how it used to be. It's just much more efficient in terms of time management, because social distancing is of the utmost importance.
Thank you. If breast cancer is diagnosed, what might treatment look like? Is one modality being favored over another? Is treatment being delayed at this time?
Modality, you mean in terms of how we do our biopsies, or?
Sure.
So I think, no, we're doing all modalities. If you need a biopsy with using mammography or using ultrasound or using MRI, we can do whatever is needed to be done, just like as in pre-COVID times. In terms of treatment, there is no delay in treatment. People are getting in to see surgeons if they need it, or radiation oncologists if they need it. The thing that has changed is obviously these telemedicine, kind of using Skype or using Zoom meetings for your appointments initially. And so they won't all be in person. I think that's the big change, but there's no delay.
That's something a couple of our previous guests have shared as surgical oncologists about telemedicine, which has become so important in very interesting and unique ways now.
Right. Yeah. I feel like it satisfies a lot of areas, but then other areas it's not like a complete substitute for an actual.
I think you and I talked about Dr. Natalie Johnson, who discussed that as well. That I won't repeat here, but I want to thank you again, Dr. Gibson, for being with us from Providence at St. Vincent. And as many of you know, Providence, the Providence Cancer Institute is such an amazing partner with Komen, and they do such amazing research and work there. So I want to thank you again for taking your evening to be with us. Those are the questions that I had for you. I would welcome questions from the viewers that are joining us today. So Alice, if there are any questions that have come up on your end, if you could present those now, that'd be great.
Yeah, we did have one question come in, and it just says, if someone is concerned, what is the time frame they're looking at to be able to get an appointment for screening or mammography?
Oh, they can schedule their appointment this week. If is that the question? Like, when can they get their appointment scheduled?
I think so. That's how it reads.
Yes. So they can go online. They can go to trgimaging.org. There's a button there that they can click, and that will take them to wherever they are located, if they're here locally or if they're out by at Newburgh or Seaside or wherever. Even for the imaging centers, it gives a phone number as to where they can call if they need to make an appointment. But yes, we're doing appointments every single day, so it's not being pushed out weeks or anything like that. I think, what is today? Wednesday? Yeah, maybe even by Friday.
It's hard to know. Every day is the same day. It's a Groundhog Day. Are you seeing now an uptick of screening appointments coming now that people are feeling a little more comfortable with phase one coming in certain markets?
I think so. I think people, I think they want to get their healthcare taken care of, and I think they want a sense of normalcy. And I think it has definitely helped that we were able to get people in so quickly and out very quickly. I think people have just had a good experience overall at our institutions. So,
well, screening is so important, and we want to make sure that people get back to normalcy, getting screened and feeling safe. And Providence has the correct protocols in place. I want to remind our audience that most health systems are doing the same, and they should call their provider for more information and to schedule all their mammograms. We're updating our website as well. We have a COVID-19 page at komenoregon.org. So as we are reaching out to health systems like Providence, please do check with us, because we want to make sure that people are going in to get screened at Providence and other health systems. So thank you. That's very important for us to be able to put out there.
Yeah, and that's incredible that you're able to get everyone in so fast and out so quick. That's great. Another question we had is it safer to wait to get screened versus come in and risk COVID exposure?
That's a really good question. I think that's a very fair question. And I think that is, I honestly think that's a very personal answer. It kind of comes up to, what do you, like, what is your risk? Like, are you high risk or intermediate risk or low risk? And I think that's a conversation that you can have with your primary care physician, because I think everybody's going to be different. And I think, for me, like for my wife, she asked me the other day if she should go in and get screened or if she should wait. And I feel that things are very safe and she can go in and get screened. I think if you're immunocompromised, it might be a different story and you probably should wait. But I think that's a very individual question.
Great. Those are the questions I have.
Well, I want to remind folks that please go to komenoregon.org for resources and updated information on screening. We also have a treatment access program for those who are in care right now for breast cancer treatment, where they can receive resources for gas, food, and lodging. That program is actively running. Dr. Gibson, can you share the website that people can go to at Providence?
Yeah, so it's
for screening.
Sure. Well, so yeah, it's www.providenceoregon.org/breast-cancer. And then I think, and actually I also wanted to hit on, if anybody's listening, that is either going through current treatment or has a recent diagnosis of breast cancer. I think, it's a very multidisciplinary approach to breast cancer, and we have multidisciplinary meetings every single week. And as a member of the Providence Cancer Institute, we're continuing to do those every single week. And I would say things are today as they were in pre-COVID times. We're just more efficient in terms of our time management and social distancing. So I think if there's any anxiety or any hesitancy about coming in to getting your screening done, I feel confident in saying that it's a safe place to come to.
Thank you, Dr. Gibson. Anything else you want to add before we sign off?
No, that's all I have. Yeah.
I just want to share with our viewers how much we appreciate, and with you, Dr. Gibson, how much we appreciate our partnership with Providence Health Systems and Providence Cancer Institute. We've worked on so many levels with you, and the work that you're doing and the guidance and the direction you're providing for the community in the space of breast cancer and all cancers is tremendous. And as an organization, we're so fortunate to be in the space with you.
Well, thank you very much. Thank you. And thank you very much for having me this evening. I really appreciate it.
Thank you. And to our viewers, we will return next Wednesday at 7 p.m. Our next subject is talking about the impact of the pandemic on clinical trials and breast cancer research with our friends at OHSU. So please do tune in next week, and more information will come out to you. But in the meantime, be safe, be well, and we wish all of you and your families and loved ones good health and safety. Have a great evening, everyone.